Okay, so the PSA, it's had a whole lot of bad press recently, actually over the past number of years, and how it's supposed to be used. Our approach to it, and things that we've learned through the Southwest Oncology Group and the prostate cancer prevention trial, is that PSA actually is a formidable blood test to discriminate a person's risk of prostate cancer, and especially his risk of aggressive prostate cancer. The problem is if you use PSA by itself, it's a bit like using cholesterol by itself to evaluate a person's risk of heart disease. It has to be used in conjunction with other risk factors, for example, family history, race, ethnicity, age, rectal examination findings, and whether somebody's had a prior biopsy before. And so the way that we approach it is we use the prostate cancer prevention trial risk calculator, which has now been validated in multiple cohorts of individuals. And what it does is it takes into account all of these factors and individualize a person's risk. It also looks at not just the risk of cancer, but the risk of high-grade disease. And as far as I'm concerned, that's the risk that dominates a person's risk of problems from his disease. So that it helps discriminate, so that you can identify a person who has very low risk of prostate cancer, and also then incorporate these other risk factors. For example, an African American man who may have a family history of prostate cancer, who's older, whose risk at any given level of PSA can be extraordinarily higher, risk of high-grade disease. So perhaps putting some of the myth away from PSA and some of the disparaging comments, it's really that PSA cannot be used anymore as a normal abnormal, but has to be used in the range of PSA values and with other risk factors. And the simple thing is, if you either Google prostate cancer risk calculator, you'll find it, or if you go to www.prostate-cancer-riskcalculator.org. Sorry, I had to think for a second. The simplest thing is to Google prostate cancer risk calculator. It's always the top hit. Go there, make your doctor use it. If your doctor doesn't use it, you're missing a lot of the information that can be used with the PSA test.